Good afternoon, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. I'm your host, Raina Andrews, and for those of you tuning in for the first time, let me just introduce myself. I'm a mother, a children's book author, a public health ambassador, a TEDx speaker, and an engaged community member. I'm your host for the 2023 Coffee with Conversations with Scientists series. Coffee Conversations is brought to you by the Advancing a Healthier Wisconsin Endowment, a statewide nonprofit working to improve health and advocacy and advocate for health and equity across Wisconsin. Since early in 2021, we have been sharing the science behind today's most important health topics. And today is no different. And as a matter of fact, today is very personal as we're talking about a very complex topic that doesn't have a lot of information around it. And so I'm assuming that it'll be very popular. Today, we're joined by a specialist, a expert, Dr. Kathleen Koth, who is a child adolescent psychiatrist, associate professor in the Department of Psychiatry and Behavioral Medicine at the Medical College of Wisconsin. Now, because autism spectrum disorder is such a big topic, I really want to frame this conversation to let our viewers know that we're focusing on really what is autism spectrum disorder, how are people diagnosed, and we want, even in that vein, that's a big enough meaty chunk for us to really unpack what this spectrum is and how people can be diagnosed with it. Where does it come from? And we're going to try and bring you as much information as possible in our 30-minute coffee break. And we also want to open it up to have our audience be able to ask some questions of us. So with that, let's get started. Welcome, Dr. Koth.
Thank you very much for having me today.
Yes. So as I said, all of our viewers out there, we're going to have a list of questions that we'll be asking Dr. Koth. And I really want you to be active and I really want you to be engaged. And so we'll leave some time at the end to be able to have you ask those questions. But first, let me get through the preliminary questions of just asking Dr. Koth, what is autism spectrum disorder?
Okay, so it's a disorder that's defined in the Diagnostics and Statistical Manual, which is put out by the American Psychiatric Association. So it's a list of 5 criteria, and each of those criteria have some breakdown. But somebody needs to meet all 5 of those criteria to have autism spectrum disorder, according to it's known as the DSM. So the first criteria, A, is persistent deficits in social communication and social interaction across multiple contexts. And those can be social emotional reciprocity, nonverbal communication and behaviors in social interacting, and developing, maintaining, and understanding relationships. Criteria B is restrictive, repetitive patterns of behavior, interests, or activities. And it has to have at least 2 of the following. So stereotyped or repetitive motor movements, uses of objects or speech, insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior, highly restricted fixed interests that are abnormal in intensity, or hyper or hyporeactivity to sensory input or unusual interests. You also has to have these symptoms present early in the developmental period. The symptoms have to cause clinically significant impairment in social, occupational, or other important functionings to meet the criteria of a disorder. And the disturbances can't be better explained by intellectual developmental disorder or intellectual disability. And that's the definition of autism spectrum disorder.
So are people actually put on a spectrum based on the severity of these 5 points?
Yes, actually, further on in the criteria, it talks about different levels of severity, and there are different specifiers you can add on to indicate someone's other issues with it, language, that kind of thing. So it's a very broad spectrum meeting these criteria.
So you talked about early detection, and I've heard that from different people talking, what I've read on Dr. Google, I've heard that autism can be hereditary. Some get it from environment. Can you share how someone develops autism?
Right. The biggest answer to that is we don't know. And it is probably multifactorial. So if it had been one thing, we probably would have found that one thing by now. It looks like about 40 to 80% of it have a genetic root. That can mean it is passed down from parents. It can mean that is something that happens in the formation of the chromosomes, in meiosis and the formation of an egg and a sperm and all of that beginning of stuff. It can also be there's a huge field of epigenetics, which is how the environment interacts with our genes. And
Mhm.
so there's a lot of that. Plus, there's a lot of things that we've looked at that we correlate with autism, meaning we have found that these things kind of happen with autism, but we don't know about cause.
Mm. That's a very important distinction that you make. Correlation, not causation. So, when you talk about environment, when we say environment, it could be pesticides, air pollution, medications. Can you share what types of medications, particularly when a woman is pregnant, that could affect or can cause autism?
So we don't have specifics on exactly. We do have some correlations with women who have taken particular medications and have children with autism spectrum disorder. The problem is that most of those things that are being treated, we actually don't have good data on what those things are treating and whether those untreated can cause autism spectrum disorder. For instance, we know that women who may take SSRIs for depression or anxiety have a higher risk of autism afterwards, but we actually don't have any data as to what depression or anxiety have to do with developing autism. So it's not a reason not to take those medications because we actually know that untreated depression and anxiety in pregnancy can lead to some very bad outcomes with pregnancy. So it's very these are correlations, these aren't causations, which is why there's no absolutes in this, and these have to be individual conversations with your doctors.
And that's exactly why I say this topic is very complex. At least we'll get as much accurate information as possible here, from what the research shows to date, because I understand that this is constantly evolving. And so, speaking of constantly evolving, there seems to be a serious uptick in the number of individuals being diagnosed with autism. Like, I was reading a Center for Disease Control report, dated in 2021, and in 2021, there was 1 in 54 children had been diagnosed with autism by age 6. This was back in 2016. And as of 2000, it's 1 in 150. So that's a significant jump in a very short period of time. So in 2000, it was 1 in 150 people were diagnosed, but as of 2016, there were 1 in 54. And so I'm just wondering, what is the possible correlation, or why is there such an increase in the number of people being tested for or resulting having autism?
It's a great question. And the current data that came out from the CDC this year in 2023 is 1 in 36.
Wow.
And so that's 8-year-olds. Now, what we're talking about is prevalence. So
Mhm.
prevalence is the number of cases being diagnosed that has increased drastically. There were a lot of good reasons why we're having an increased number of people being diagnosed. It starts when we start collecting data from it many, many decades ago. We have expanded the diagnosis to include a broader spectrum of people, so we're capturing more people. We are now screening for it. The American Academy of Pediatrics recommends screening at 18 and 24 months for autism spectrum disorder, which that did not happen a couple of decades ago. People know what this is, right? People actually have heard of this, so people are looking for it, whereas in the 1970s, we weren't. And so some of this
Mm.
is an increase in prevalence. Now, incidence is the increase in actual numbers of people with autism. And
Oh,
that has not been studied. I want to be very clear that has not been studied. It is theorized that there actually hasn't been an increase in incidence, that the increase is in prevalence, and that we're getting better at finding it because we have things we can do with it. We can help people. We can mold things. We are looking for different things, but the incidence has not been studied. And it is while some people have theorized incidence is increasing a little bit, others say it's not at all. We don't have good data on it.
got it. When I asked, how do you define autism spectrum disorder? In that definition, you also talked about early detection. And just a second ago, you mentioned um, diagnose diagnosing between the ages of 18 to 20, 18 to 24 months, how young can you learn if your child is possibly or will be diagnosed with autism?
That's a good question. So the recommended screening from the American Academy of Pediatrics is at 18 and 24 months. The literature on when it can be diagnosed is a little mixed depending on where you are. 15 months seems to be a good spot that a lot of the literature can do on. There's some that says 18 months. In some very frank cases, it could be as young as 12 months, although that's not as much. Some of the tests can go down to 12 months, but certainly in that range, we're looking probably in the 15 to 18 month range. It can be diagnosed. Now, with that being said, with all neurodevelopmental disabilities, one of the important things to remember is a lot of times we don't see issues, or things are not picked up until demands exceed ability, which means
Oh.
until the environment, whatever those demands are, be it school, be it socialization, be it whatever, exceeds the ability of the child to meet those, and then everybody starts picking up on things. And so obviously the more mild somebody is, the longer that can go before we start to pick up on those nuances. And that's true of all developmental disabilities, including intellectual developmental disorder. And so there isn't a time that it gets diagnosed, it's when it's needed, but we do need to be we first really look for every child at those 18 and 24 month visits.
Hmm. Mm, that's important to note. So, how is autism diagnosed? What is that process?
So that's a really good question. Currently, you see a specialized tester, usually to diagnose autism spectrum disorder. The reason I am involved in advancing Healthier Wisconsin Endowment is actually to pilot a tool that we are bringing in from Vanderbilt and from Tennessee to see if we can help our pediatric primary care colleagues make the diagnosis of very obvious cases.
Mhm.
And so there are never going to be enough specialized testers to meet
Mhm.
the demand. Obviously, as we've said, the prevalence is increased. The number of testers has not and will not likely. And so we have a bottleneck of people waiting to get testing, and that those wait lists are long. And so that was actually the point of this study that I'm involved in, is to see if the very obvious cases that do not need extensive psychological testing can be
Mhm.
diagnosed using some very specific tools by the pediatrician or the primary care provider.
Mhm. When was that study launched, and when will it conclude, and what are some of your early findings?
The study was officially launched in 2021, and we have worked with several pediatric providers in the area. And officially, our grant concludes this next summer. However, we are going to ask to continue it beyond that. And our initial finding is that the primary care pediatrician can feel very confident. We're talking cases where the primary care pediatrician or pediatric provider pretty much already kind of knows this, and we're
Mhm.
looking for the documentation and the testing to support it. So we're not talking about cases where we're really unsure of what's going on, where we really need in-depth psychological testing. This does not replace that. This
Mhm.
replaces the people sitting on the wait list, where the psychological tester is not really going to need to do much, and everybody kind of already knows. And just kind of reducing one of the things we have to do in the mental health world is very carefully think of our resources. We don't have enough resources. So how can we make those resources most useful? And we're seeing how this goes. We are collecting data on comfort, and we have not analyzed that data yet.
I would love to see your report and have you back once you have your conclusion of your pilot. In your sharing, you mentioned barriers and bottleneck. And before we turn to the audience, I do want to better understand what are some of the barriers or reasons for bottleneck in diagnosing children.
Well, one of the things, oop, you blipped out, I'm sorry. I don't know if everybody else can hear Raina, but I can't. Okay, I'm just going to talk while Raina does that and start to answer the question. Oh, now you back?
Yes, I'm back.
Okay.
Um, in your study, you mentioned diagnoses of those who have autism. I'm wondering what are some of the barriers or bottlenecks for those who you're not sure if they're on the
Yeah.
spectrum?
Well, first of all, is the wait list. The wait lists are long. There are not enough services. That is absolutely true. And that is a reality that, a lot of people have tried to change, but it has not. And so there are long wait lists. And all the things that make getting a child to an extra provider. So transportation, more time off from work for parents or guardians who are trying to get them for more testing. Um, Language barriers, just everything that we put in front of a family getting to a different office at a different time for a different test makes this even harder.
Mhm. Well, Dr. Koth, we've really set the foundation for what is autism spectrum disorder, diagnosis, prevalence. We have a very chatty group here, and within the next 13 minutes, I'm going to try and get to as many of your questions as possible. One of the questions from our audience, if you don't mind us just turning over here, is one is why is it harder to get girls diagnosed with being on the autism spectrum? Where is the best place to take a teenage girl you believe is on the autism spectrum to be diagnosed?
That's an excellent question with not a good answer. So I'm going to tell you what it is, and not sugarcoat it. First of all, our diagnosis is very male dominated, as is medicine. Okay, so this is not a problem just in mental health. This is a problem, and so people are looking at the diagnosis and looking at the criteria as we may be missing the mark in females. I hearken this back to it took a very long time for us to get heart attack symptoms for females that are different than males. And so we're there and we're trying to work on that. Teenage diagnosis is very difficult in that there are less people who are doing that diagnosis, but it is
Mhm.
out there. If you are in Wisconsin or actually around the country, I really highly recommend you looking at the Autism Society. Most of our Autism Society groups, they're very regional groups, and they have a lot of resources and they know who in your area can do that. If you happen to be here in southeastern Wisconsin, the resource guide on the Autism Society website is fantastic. And you can just go on and it lists, and it has a great amount of detail under each person testing, including what kinds of insurance, whether they speak Spanish, what ages they test, things like that. But your local resources are going to be fantastic in helping you find those pieces. Are there enough? No.
Well, Dr. Coate, that is an excellent resource, and we're putting it in the chat for our audience right now. It's Autism Speaks and Autism Society of, is it Southeastern Wisconsin or
So
Wisconsin?
there's autism societies throughout Wisconsin. There's different regions. So I know there's a central, they're very active. I am most familiar with Southeastern because that happens to be where I am clinically
Mhm.
practicing, but I have interactions with the other ones because my patients come from all over the state and actually a few other states. And so just I know the local chapters tend to be very active and very helpful. So that can be a place that you can start and turn to.
Wonderful. So you can check our chat and you'll be able to see these resources for Autism Speaks and the Autism Society. The next question is what once was referred to as a learning disability seems to have been rolled into autism spectrum disorder. Is this correct?
No, actually, it's not. There are still learning disorders, and the reading, writing, and mathematics are the three learning disorders. So, learning disorders are very different. They lack those criteria that I talked about. So, someone can have a great deal of difficulty reading, for instance, and not have the socialization issues or the repetitive behaviors or some of those other criteria that we talk about.
Mhm. The next question is, since there's a lot of overlap in symptoms between ADHD and autism, what features do you use to tell if a person has one or the other or both?
It's a very good question. Um, ADHD is actually very, very different from a clinical standpoint in the hyperactivity, the inattention, and the impulsivity, right? Those are the three big criteria for ADHD. While people with ADHD may have difficulty with socialization because of the attention piece and the hyperactivity piece, they
Mhm.
tend to not have those repetitive restrictive behaviors, the other criteria that we talked about. And sometimes it takes, especially when I personally clinically see people as an outpatient, sometimes it takes a while for me to get to know somebody to make sure that I'm looking for that. But again, a good psychological tester is looking for the differences between those two.
Mhm. And it's ensuring that they have to meet all 5 points that you went over in the very beginning of the segment?
Yeah, for autism, you have to eat those criteria. The criteria for ADHD are different. And
Okay.
you can have both, or you can have one or the other.
Mm. Do you find that diagnosis for autism have become more streamlined now?
Streamlined. Um, I mean, it depends on when we're talking about. I'm lucky to have done this for a couple of decades in a couple of different lives. And so is there more testing now than there was in the early 90s? Yes. But I don't streamlined, I'm not sure. Depending on where you are, there are places in the country that are doing this very well, and it is much more streamlined. So it kind of that depends on where you are.
Mhm. When you say different places, across the country, do you have some specific states in mind?
Just there are some health systems or some county systems where that is more it's in some systems the school does more psychological testing than private testing. It's handled very differently in different places. And so it's hard to speak to. um
Mhm.
Here, at least in my experience, it's kind of you've got to find the tester and get on their wait list and that kind of thing. So there's a lot more available than there was, but I think it's still very difficult for families. Too
Mm.
difficult.
So speaking of families, these next two questions from our audience are really around how can parents support their children. And so this one question has to do with the study that's supported by Advancing a Healthier Wisconsin. And the parent wants to know, how do you get involved with the study as a parent?
It's a great question. It's actually not a parent study. I'm so sorry. It's a study enrolling pediatricians and or pediatric primary care providers to learn this tool. So I
Mhm.
appreciate your want to get involved in research. And there are other ways to do so. This particularly was working with pediatricians, and the pediatricians are enrolling, and understand that pediatricians want to participate versus ability to participate also sometimes depends on their employer. And
Mm.
so, the pediatricians that we have are doing a wonderful job, but that's not available. The time we're asking is not available to everybody. So that's great. If you are interested in research with autism, there are lots of times and lots of things that families can participate. Research.gov through the US government always lists all the NIH funded research projects that are happening across the country and who are rolling. The other foundation that's doing a lot of research is the Spark Simon's Foundation. They have a lot of research in autism. Lots of other places where families who are very interested in research, and we love that you're helping us advance, what we know. What we do know is from our families and from our individuals, and that's the only way we can grow and continue. So thank you for that question. Um,
Mhm. The second part to that question is are there ways to reduce the level of embarrassment or even shame with this diagnosis?
I think yes, and I think part of that is teaching everybody and informing everybody, um,
Mhm.
and
Awareness.
and
Mhm.
us helping, right? And this is in my world as a child and adolescent psychiatrist, right? This is stigma, right? We all have
Right.
stigma around mental health issues. We have stigma around intellectual developmental disorder. We have stigma around autism. The more people we educate about what it is,
Mhm.
the better that they can both treat the person in front of them and then everyone they meet afterwards. So I think us continuing to educate even one person at a time is one person more than knew the day before. And
Mhm.
we just have to kind of build on that.
Mhm. There's a lot of interest in your study, Dr. Koth. One of the audience members is asking, where can they find more information about your study and keep in contact on your findings? And another piece is, how do you find a list of which doctors are participating in your study?
So, due to IRB, which is the institutional stuff we have to do, I can't tell you who's participating or not because that
Mhm.
has to be confidential. And then just the data that we're collecting from the pediatricians and the primary care providers has to be confidential. So we have to be able to do this in a very scientific manner. And so I can't tell you. I'm very sorry. Um, but I'm glad you're interested in it, and we are hoping to continue it. And we're hoping to see what we can do after our funds end, to continue on this project of trying to get more services out into the community. This project too, I need to, if I can take 2 seconds, this is
Mhm.
not me and my project. This is a group of people. So Dr. Amy Van Hecke in the Department of Psychology at Marquette, Dr. Amy Leventhal, the clinical director of Next Steps Clinic, Dr. Nora Johnson, who's with the College of Nursing at Marquette, Dr. Mary Clarkson, who's at Marquette in the Department of Educational Policy and Leadership, and Leah Jepson with Mental Health America. This is a team effort. None of us are, I'm speaking today, but all of these people could do the same job. And we'll continue to follow that. And so hopefully we'll get stuff out from it. We're just not at that point yet.
Mhm. I appreciate that, the acknowledgement, the edification, the shout outs. We have two more questions. Do you think we can pull through here?
Oh,
Just to
I'm
get through
fine.
them?
You're the
Awesome.
time.
Awesome. So, we talked a lot about early detection. This one is more so for those who have been undiagnosed. So, the question from our audience is, what steps would be taken to assess an adult who may have undiagnosed autism spectrum disorder so they can be directed to appropriate resources to develop life and coping skills?
It's an excellent question. So those resources that you can find through a lot of the autism societies and things, when they have the testers list and they'll list the age, many of those people will see adults and
Mm,
complete the testing on those adults. So I think that's super important to find somebody. There are less people who test adults than children, so that is a harder thing to do and to find. But there are things out there. I would look for a good testing psychologist,
mm.
who can do that.
What is like the title? If you're looking through the list of doctors in your insurance, what kind of psychologist would that be?
It's going to be somebody who has special training. And that's why I think you're going to have to put your insurance list up against the list from the Autism Society and kind of see who
Got it.
crosses with that. Or Autism Speaks, or one of the other autism groups that lists people in your area who test, and kind of cross reference.
Perfect. The last question is, speech is becoming recognized as a motor planning disorder. Many adults with autism are communicating fluently in another way than speech. Is this recognized yet in the medical community? If so, what type of testing or treatment is available for motor planning?
Motor plan. Okay, so I'm not a speech pathologist. There's
Mhm.
speech pathologists are fantastic and they are an important part of the group of people who work with individuals who have autism spectrum disorder. Um, and so speech, there is a motor planning portion of speech. There's also several other cognitive parts of speech that all have to come together. Speech is incredibly complex, neurologically, musculaturally, in a lot of ways. So there's a lot of work that speech pathologists can do. There's also an entire body of literature, which I am not going to pretend to be an expert on in the speech pathology world, in working with the communication disorders of a lot of individuals, including those on the autism spectrum disorder. My clinical specialty is actually usually working with people who are minimally nonverbal. And so we are using a lot of other ways to communicate and working with their speech. And so communication is an important part with autism spectrum disorder. And that is a very, very broad, that's a whole nother lecture for another time, I'm afraid.
Yes. And well, With that, I want to thank you, Dr. Koth, for joining us today. We appreciate you for taking the time to talk about this very important topic. And as I said, folks, at the very beginning, this is a really dynamic, complex, broad topic. And for our coffee time, we just had to break it down into this big chunk. And hopefully, we'll have you back again to share more details about your study and the other parts of autism spectrum disorder. So, thank you for joining us.
Thank you very much.
And I see the chat still rattling on. So if we didn't get to your questions, I sincerely apologize. Feel free to send me a note at conversations@mcw.edu. I hope you all enjoy our coffee conversations with scientists. You were fantastic. And remember, in the chat, Dr. Koth suggested two resources, Autism Speaks and Autism Society. There's an Autism Society of Southeastern Wisconsin, if you live here in the greater Milwaukee area, that we encourage you to check out. Tune in next time. See you soon. Bye bye.